Gilby has a City and Guilds Further Education Teaching Certificate and is a tutor for ITEC, the International Therapy Examination Council, and a member of the British Register of Complementary Practitioners. Carol has a private practice in complementary therapies and teaches in England and Japan.
Right, these are just a few questions I'm going to ask you to make sure.
In this video, Carol will take you through an introduction to holistic reflexology, so that those who wish to pursue this form of holistic therapy will have a firm grounding on which to do so. The ancient Egyptians understood that the massage of pressure points in the soles of the feet generated reflex responses and conditioned responses to behavior. In effect, they discovered that a map of the internal body is registered in the feet. Today, that discovery has led to the development of a technique for relaxing nervous tension and assessing body imbalances through foot massage. Many conditions can be alleviated with reflexology. The human body is constantly trying to maintain homeostasis, or a state of balance. But due to stress, injury, bad diet, lack of exercise, and the resulting build-up or poor elimination of toxins, the body cannot cope, and sickness sets in. Reflexology can help restore and rebalance the systems of the body. Working on certain pressure points, a qualified therapist can locate restrictions, congestion, and imbalances, and alleviate them. However, the therapist must not promise a cure, name a specific illness, or take a patient off prescribed medications. And patients must not be told anything that may cause panic or distress. It is better to undertreat than to overtreat. And though therapists will make mental notes as they work, the patient should only be told what is necessary, and not everything that is found. Quite often, as one area of the body begins to heal, the other imbalances will take care of themselves. So it's not necessary to overburden anyone with diagnostic information. It must also be remembered that other complementary therapies can be used alongside reflexology, such as aromatherapy, herbal formulas, and body cleansing. Finally, practitioners of reflexology use a general terminology. Words such as congestion, imbalance, restriction, and area. As a therapist, it's wise not to specify what you cannot confirm. So, for example, if you diagnose a patient as having congestion in the uterus, it would be better to simply suggest congestion in the area of the uterus. They may have had a hysterectomy, and you could be picking up scar tissue. Equipment. Reflexology can be practiced anywhere, from a chair to a bed, so it's an excellent therapy for someone who's bedbound. As the therapist, you must be comfortable, and you must look after your back. So it's important that your patient's feet are the right height to work on. If you're going to use a couch, make sure that it's suitable for your height. Don't use one that makes you lean too far forward or stand on tiptoes. If you use a couch, you'll need a fitted toweling cover, a paper or cotton sheet, 2 large pillows, a large towel, and a smaller towel. If you don't have a couch, then a towel and a pillow may suffice. In any case, what you use is changed afresh for each patient. Your room should be warm, well ventilated, comfortable, and clean. And you should be professionally dressed with your nails cut short. Talc or oil may be used, though some therapists prefer to use no medium at all. What you use depends on your technique and preferences.